Hi, Stacey. My name is Lori, and I'll be narrating your surgery today. Your surgeon is Dr. Carey, and at this time he is saying a prayer. Okay, so he's just getting the microscope positioned. And of course, this is your eye on the screen here. It's being magnified at approximately 40 times its natural size. It's being held open with eye springs, and it's very nicely dilated. Doctor loves that. Gives him lots more room to get that cataract out. So he's going to begin by making a small opening in the protective membrane that covers the white of your eye. That membrane is called the conjunctiva, and the white of your eye is called the sclera. And here he's just cauterizing the little blood vessels to reduce bleeding, but very little blood is lost in this surgery, usually less than a drop. I'm just going to use a sponge there to dry off that surgical site. He's going to use a small diamond tip blade to make the main incision. That main incision is approximately 1/8 of an inch long, usually requiring no sutures. So I'm going to make an incision on each side at the edge of the cornea. These little incisions are just used for secondary instruments today. He's just going to add some fluid to your eye. It's just a cushioning fluid. He's going to use a second diamond tip blade. This one's going to reach down into the anterior chamber. That is where your cataract is located. So that does complete the main incision and all of your incisions for today. He's going to reach in with a little bent needle and pierce the lens capsule. So that lens capsule does surround your cataract. We like to compare your cataract to an M&M. So the chocolate part of an M&M would represent your cataract, and the hard outside shell of that M&M would represent this lens capsule. So he's just peeling this capsule in a 360-degree turn. He's just creating a window or an opening in the front so he can get to that cataract inside. He's just taking a hold of that with a pair of tweezers here to remove part of that. So now he's going to add some saline solution. This is just going to surround that capsule. It loosens it, makes it free floating and safe to be removed. This instrument is an ultrasonic instrument. It is called a phacoemulsifier, and the tip of it vibrates at approximately 40,000 times per second. It's going to liquefy that cataract material and then section it away at the same time. So he's just going to kind of burrow down in the center a little bit just to get it started. And he's going to use this instrument with a little paddle on it, and he just uses that to help break it up. He's just going to break this up into smaller pieces, then suction those smaller pieces away. And he uses that little paddle to help turn it also. So now he's removed that main part of the cataract. And what you see that's left here is still part of that lens capsule left in there, but around the outside edges it's called cortex. It's just kind of that web-like substance. So he's just changing instruments. This one is not ultrasonic, just has a gentle suction to it. So he's just going to gently remove all of that cortex and the rest of that lens capsule and making sure it's nice and clear for you. This here is a polishing ring. It just lifts off and loosens any little microscopic particles that might have been left behind. Here he's going to add a thick fluid called Helon. That Helon is going to keep that area of your eye open and cushion the arrival of your new lens. So your new lens is 1/4 inch wide, so it needs to be folded to fit through that tiny incision. But once it warms to your body's temperature, it just simply unfolds and lays flat and is going to take the contour of your eye. And of course, you can see that little blue arm that's on there, one on either side. Those are called haptics. Those little haptics work just like tension springs. So he's going to help this little lens to open up, and those little haptics pop down underneath the iris there. They're going to put just the right amount of tension on either side to hold that lens perfectly in your field of vision. Here he's removing that thick fluid, then he's going to replace it with a balanced salt solution. And of course, your eye is still very dilated, so once that dilation goes down, you won't see the edge of that lens at all. It'll just fit perfectly in the center. Here he's adding some fluid to adjust the pressure of your eye. He's checking that incision. These are all self-sealing incisions. Replaces that conjunctiva at the top. You did just receive your first set of medicated drops. They take out the eye springs and your surgery is complete. Well, enjoy your new vision, Stacey.